Failure to thrive means child is not growing optimally. It is being understood by the parents. And because we frequently he or she sees the people, children around a little bit better of his height and in terms of the height and weight. So the mother says, now look, my son and daughter is not growing. In those cases, commonest cause in this country, in this part of the world, is the protein energy malnutrition. Take thorough physical history, including the exclusive breastfeeding up to 6 months, then appropriate complementary feeding 1 feed, 2 feed, 3 feed in 6 months, 7 or 8 months, or 9 months, and so thereafter five complementary feeds of good composition, appropriate composition, protein, fat, carbohydrate, vitamins and minerals, and so not excessive, not low also. So if they are all right, it is now the other issues. Most of the time, you do have deficiency over here. Food calorie was not appropriate, 1800 or 2100 per kilocalorie per day in an adolescent boy or girl, respectively. So they are not there. So this is primary malnutrition. They are there, but child have other issues like he's severely pale, he is hypertensive, he has microscopic hematuria or proteinuria. You know, you do one ultrasound and you do your creatinine and other lab data for the CKD. Most of the time, you have this diagnosis. You may have electrolyte changes consistent with the CKD. You may have electrolyte changes consistent with the tubulopathy. They also have a little bit your the security progression and renal impairment a little bit. So the next step is to see the gut, the diarrhea, acute, chronic, recurrent, and look for the features of the malabsorption syndrome, Crohn's, ulcerative colitis, or your cystic fibrosis, celiac disease, and others. So if they are not there, you know you examine the CNS, microcephaly, hydrocephalus, cerebral palsy, neurodegenerative disorders. These diagnoses are obvious on clinical examination and thorough history. So lung, the bronchiectasis, tuberculosis, cystic fibrosis, interstitial lung disease, few more uncommon diseases can have these sort of things, but they are not that common. So, cardiac cause of growth failure or the height weight compromise is due to the congenital valvular heart disease, recurrent heart failure, left ventricular, and congestive cardiac failure. So, cardiomyopathy rare but possible. Bony dysplasia, dysmorphism is to be looked upon. Endocrine causes with hypothyroidism, your with TSH elevation, T4 decrement, T3 decrement, and your the diabetes, the early onset, the insulin dependent diabetes, type 1 diabetes, they can be investigated by full fasting blood sugar and HbA1c, hypopit, not that common, but it is to be looked upon. Now they have low IQ and other issues, and the pituitary function, still a tertiary assessment. And finally, the hemolytic anemia, thalassemia, they are very obvious clinically and can be assisted by your electrophoresis and blood film chromosomal symptoms like Downs and others. They are also obvious clinically. So meticulous investigation from common to uncommon, meticulous clinical exclusion from common to uncommon. Most of the time, you are able to reach to a conclusive diagnosis and treatment of those diseases as per guideline, as per the text.